that the situation in our country is not getting better. It is getting worse.
Matamshi ambayo sasa yanaashiria taswira kamili kufuatia kusambazwa kwa virusi vya corona humu nchini. Waziri wa Afya Mutahi Kagwe akitangaza ongezeko la waathiriwa wa virusi vya corona humu nchini saa 24 tu baada ya 22 kuthibitishwa kuambukizwa virusi hivyo hapo jana.
We have managed to test a total of 662 samples. You will notice that this is a new record in terms of our daily testing capacity. This is because of activation of testing facilities across the country and additional testing facilities in private facilities. Out of the 662 samples, 29 people have tested positive to the coronavirus disease.
Waziri Kagwe akisema kwamba Wakenya 22 ni miongoni mwa walioambukizwa na mwingine akiwa raia wa Jamhuri ya Demokrasia ya Kongo, huku 29 hao wakiwa kati ya umri wa miaka 16 na 64.
This number, I must say, is going to rise, and it is going to rise exponentially. It is important for us to note that this virus does not move by itself. It is moved by you and I. We must change our behavior and attitude if we are to cut the transmission of the virus.
Kagwe akiongezea kwamba 23 miongoni mwa walioathiriwa walikuwa miongoni mwa waliokuwa karantini.
In fact, if there are people who should be keeping social distances, it is those in quarantine. Because you are quarantined with people who themselves could easily be positive.
Vile Kagwe anasema kwamba waathiriwa hao wametengwa na wanapokea matibabu katika sehemu mbalimbali, nazo zinajumuisha
The Aga Khan Hospital recorded 3. These are the people who tested positive. People who went to Aga Khan, 3 of them. In quarantine, at the Crown Plaza Airport, 11. At the 4 Points Sheraton, 1. KISE, 2. KTI, Nakuru, 2. KMTC, 5. Kenyatta National Hospital, 1. Mathari, 1. Nairobi Hospital, 1. And Pride Inn, 2.
Na ili kuzuia maambukizi zaidi, serikali sasa imeamuru wahudumu wa magari katika sekta ya umma kuhakikisha kwamba madereva wao pamoja na abiria wanavaa barakoa kila wanaposafirishwa.
If you are getting into a matatu, you are advised to wear a mask. If you are going to ride a tuk-tuk, you are advised to wear a mask. Beginning today, we have begun local production of the face masks. We are also beginning to make PPEs for our health workers. We have now passed the tests of making them locally. But as for the masks, we are going to distribute through the counties and the chairman of border borders and the chairman of matatos what we are currently holding. However, going forward, it will be possible for you to acquire the masks and cheaply too.
The outer layer is made of a material that is water repellent, also called hydrophobic. So if there's any spillage of blood or secretions, then it does not come into contact with you. If you cut the mask, a cross-section of the mask, there's a middle layer that has a filter. That filter is supposed to be able to pick particulate matter and bacteria and therefore stop you from inhaling the particulate matter or the bacteria. Then the third layer, inner layer, is the layer that absorbs, maybe if you are sweating or any secretions or any spit from you to the person maybe you are taking care of or the person you are talking to.
Serikali vile inasema kwamba takriban wahudumu wa afya 6,000 wataajiriwa kazi ifikapo wiki ijayo ili kusaidia katika kukabiliana na janga la corona nchini. Gloria Milimu, K24, saa 1.